My name is Jiwon Min, and I'm a clinical assistant professor at the Bucheon St. Mary's Hospital. I am a specialist in nephrology. Peritoneal dialysis is a way of removing waste products and excess fluids from your blood when your kidneys can't adequately do the job anymore. So when you have end-stage kidney disease. A catheter is inserted into your peritoneum, into your abdomen, and a cleansing fluid is flown through this catheter into your peritoneal cavity. And then the lining of your abdomen, your peritoneum, acts as a filter and removes waste products and excess fluids from your blood. So after a set period of time, this filtered waste products and then the fluid is removed from your abdomen and thrown away. Peritoneal dialysis in comparison to hemodialysis is recommended in patients who are mobile and patients who are able to manipulate their catheters to do the dialysis by themselves. So they have to be able to link the fluids and then to discard the fluids after without contaminating the catheters. So hemodialysis is done by health professionals. The patient goes to the hospital and the dialysis units, the dialysis nurses, they do all the different procedures for the patient. But peritoneal dialysis is done by the patient, by him or herself. So they need to be able to keep a certain level of hygiene and a certain level of mental alertness. Or they need help from caregivers, family or friends. So the benefits of peritoneal dialysis is that there is a better lifestyle, flexibility and independence as the patient does not need to go to the hospital. They don't need to visit the dialysis unit 3 times a week, 4 hours every time. And also since peritoneal dialysis is done continuously, you have the fluids in your abdomen the entire time. So diet is also less restricted compared to hemodialysis. And patients on peritoneal dialysis also retain their residual kidney function for a longer period, mostly, than hemodialysis patients. First of all, you'll need an operation to insert the peritoneal dialysis catheter into your abdomen. So this catheter will carry the dialysate in and out of your peritoneal cavity. The insertion usually done under local anesthesia, and the tube is usually inserted near your belly button. So once the wound is healed, you'll be obviously trained on how to perform the dialysis by yourself. And first you will insert the dialysate through the catheter into your abdomen, into your peritoneal cavity, where it'll dwell for usually about 4 to 6 hours. And during that time, the waste products and excess electrolytes and fluids in your body will be transferred, will be filtered into the dialysate fluid. And then once the dwell time is finished, you would open the catheter and drain the dialysate fluid that has all the excess electrolytes, fluids, and wastes. This exchange is usually performed under different schedules according to the patient's lifestyle or needs or wants. So mostly continuous peritoneal dialysis is usually performed. Continuous ambulatory peritoneal dialysis, we call it CAPD, is done usually on a regular basis during the daytime. So the patient would let the dialysate fluid dwell for about 6 hours, and then they would do the exchange 4 times during the daytime. There is also another method called the continuous cycling peritoneal dialysis. We call it CCPD, or automated peritoneal dialysis. This is usually done using a machine that will do the dialysis exchange during nighttime while you are sleeping. So there are different methods for different lifestyles. The most common complication of peritoneal dialysis is infection. Since there is a catheter that is linking the outside world to your peritoneal cavity, an infection can develop in your peritoneum or develop along the catheter or on the catheter insertion site. That is why adequate training and avoiding contamination of the catheter is very, very important for peritoneal dialysis. Secondly, dialysate is basically sugar water. It contains a lot of sugars, so some of this sugar is absorbed into your body as well. So some patients may experience hypoglycemia, higher blood glucose levels, or a bit of weight gain due to the blood glucose. And lastly, although it's not very common, we also, because patients are holding large amounts of fluid in their abdomen during the day, this causes a strain on the muscles. So hernias can develop, inguinal hernias or umbilical hernias around the belly button, where the muscles are weak. Diet in peritoneal patients is a lot more liberal compared to hemodialysis patients because dialysis is being performed 24/7 all the time. So patients can take different electrolytes, especially potassium and fluids, a lot more liberally compared to hemodialysis patients. But patients still need to take care on taking too much fluids, too much salts, because then that could cause a bit of swelling. Also, for patients, especially on long-term dialysis, patients taking phosphorus. Phosphorus is usually it's an electrolyte that we find a lot in dairy products, in foods with a lot of protein. Those fluids contain a lot of phosphorus, and this can be retained in the patient's body as well, and that can cause in the end complications involving bone metabolism. So we restrict a bit of the phosphorus or give patients medication to control the phosphorus levels. As I mentioned earlier, infection is the biggest complication, therefore it is our biggest precaution as well. So patients must always take care on, when they are performing exchanges, they must take care in doing it very hygienically, with minimizing contamination. Even the smallest amount of contamination can cause detrimental effects with the peritoneal infection. If the infection is severe, we have to remove the catheter and stop the dialysis. So we always, first and foremost, precaution on infection for patients on dialysis, peritoneal dialysis.